I am Tara Sutton. My pronouns are she, her. So I am the Director of Community Engagement for the Red Hill Health Registry, known as just the Red Hill Registry. We work out of the Office of Strategic Health Initiatives within the University of Hawaii system. Today I'm going to share with you a story about environmental contamination and a community-engaged approach to identifying and addressing public health needs. To begin, here's our island. The circle in the middle there is the area that we'll be talking about locally. That area is reflecting Kapukaki is what it's known as. I apologize if I mispronounce. But there is an underground fuel storage facility there that was built in World War II. During the 1920s, the military began to recognize vulnerability of above-ground fuel storage tanks and wanted to find a way to protect them from being attacked. In the 30s, the concept of underground fuel storage tanks was introduced, and construction for this particular site began. The Red Hill Fuel Storage Facility paused only once during the December 7th, 1941 attack on Pearl Harbor, and then was completed 9 months ahead of schedule in September of 1943. The project employed nearly 4,000 people and was done with a top secret status. It's pretty impressive. No one knew about the project in the name of national security. If you zoom way in, I spared you the dizziness. The red dots in the middle of the screen here is where you can see 20 tanks lined up in pairs, drilled into the side of the mountain. This facility really did defy UST or underground storage tank facility norms for its time. The tanks were installed vertically, offering 5 times more fuel storage capacity than the original horizontal tank design. This facility holds up to 250 million gallons of fuel and other chemicals and is the largest underground fuel storage facility for the DoD in the Pacific. The project was $6.25 million, equivalent today to $135.5 million. When the site was declassified in '95, the American Society of Civil Engineers placed the facility alongside the Hoover Dam, the Eiffel Tower, Panama Canal, and the Statue of Liberty as a historic landmark. In this depiction, what you're able to see, the blue on the bottom is the Moanalua Aquifer, and above is the, I'm going to mispronounce it if I can't, Waimalu Aquifer. If you were to take this image and flip it this way, then what you would see is that the bottom of the tanks sits only 100 feet above those aquifers. The Red Hill Bulk Fuel Storage Facility contained the strategic fuel reserve for the whole Pacific Fleet. So these are some illustrations of the fuel tanks, just to give you a sense of some scale. They're 250 feet tall. Now, if any of you are familiar with Oahu, you might have heard of the Makapu'u Lighthouse Trail or the Makapu'u Lighthouse. If that were to be stacked, you can fit several of them inside one tank. For those of you who are less familiar with Oahu, the Statue of Liberty could basically fit inside the tank, and there are 20 of them. Each one tank can hold 12.5 million gallons of fuel. The tanks were built with thick walls of concrete lined with a 1/4-inch steel liner. So if you look at a quarter, it's about that thick of steel. This erodes with exposure to these kinds of chemicals, and it was then encased in porous concrete, which shrinks and cracks over time. So despite the facility being an engineering marvel for its time, the tanks failed to act as an effective fuel barrier. And according to declassified Navy records, the first spill was documented in October of 1947. In 2023, the EPA stated that the total amount of fuel released into the environment attributable to this facility is unknown. There's an unknown number of spills and therefore an unknown amount of contaminants in the environment. The environment and ultimately human health depends on the integrity of a 1/4-inch, 80-year-old steel liner on the outside surface that cannot be protected from corrosion, properly maintained, repaired, or painted. So let's zoom back out just a little bit. Here we see Pearl Harbor. The red dot is the Red Hill bulk fuel storage facility as a whole, not 20 dots. The blue dots are nearby water shafts and wells, including the Red Hill water shaft that is just downhill from the facility. The yellow dot shows Red Hill Elementary School, and that's not the only elementary school in the region. The purple dot is a correctional facility. I just want to show how close the facility is to everything, especially vulnerable populations like children and the incarcerated. The center of the photo is Joint Base Pearl Harbor Hickam. This is yet another map. My master's is in geography, so woohoo for maps. This one is a lot more clear, depicting what is known as the Navy water line in our community. So these boundaries can show you where the Navy water line services versus the Board of Water Supply. It's about 9,600 households, and in all, it's about 93,000 people who live, work, and play in this area. Although we don't exactly know where that number came from, nobody's citing it, but everybody says it, so. For a quick little timeline, not quick, because I'm gonna make sure you, oops, I touched the mouse pad. Okay, so now you understand the facility, the location, its background and purpose. Let's look at how it has impacted our island. Navy records indicate a lot of spills over the decades, and as you know, there is no way to know the exact number of spills or releases that have occurred since it was built. Therefore, an unknown amount of toxic chemicals in the environment. So let's just look at the last 10 years. The first major public incident was in January of 2014, when 27,000 gallons of JP8 fuel was spilled during refueling of fuel storage tank 5. A year later, the Hawaii Department of Health, EPA, the Navy, and the Defense Logistics Agency, or DLA, entered into an administrative order of consent requiring the Navy and DLA to address fuel releases and implement infrastructure improvements in order to protect human health and the environment. In 2020, there were more fuel releases into the surface water of Hotel Pier. 2021, there was another leak of 20,000 gallons of fuel that went into the floor, and it flowed up into a sump pump. The automated pumps transferred the fuel into an overhead 14-inch PVC pipe where it stayed. As of July that year, there was already petroleum detected in the Red Hill well. And then on November 20th, in 2021, a drain on that PVC pipe of fuel was hit by a worker, a cart, and this caused the rupture and release of 14,000 gallons of JP fuel. That fuel then migrated approximately 80 feet downward through the fractured basalt, reaching the water table, and was drawn into the Red Hill shaft, resulting in a water contamination, as we know, affecting 93,000 people. Plans to defuel the Red Hill facility were approved by the Pentagon in March 2022. However, at the one-year mark of the water contamination, there was yet another spill in November 2022, but this time it was of, I can never say this word right.
Polyfluorinated chemicals.
PFAS. I can say that. The firefighting foam. So, we'll talk more about that later, actually. Okay, so now we get to October 2023, and the defueling efforts of the facility actually began. And as of March 2024, the tanks were considered defueled, and nearly all of the, all of the fuel is out, but what they're still working on is the sludge that's in the bottom of the fuel as they clean them.
Thank you, Tara. I want to apologize really quickly that our principal investigator, Amy Grace, couldn't make it today. She really wanted to be here. And so I also would like to thank Tara for stepping in so nicely. So the exposure was largely JP5, but as Tara showed you, there were also potentially PFAS exposures, potentially JP8 exposures. There's a huge timeline of exposures, and there were not just the jet fuels in these tanks, but also the additives that they put in the jet fuel. So we have a chemical soup problem of exposure because even in and of itself, jet fuel is essentially a total petroleum hydrocarbon, which is made up of several components of carbon backbone types of chemicals and other things. You can see that we tend to know the health effects of some of them, like benzene, toluene, xylenes. Those are generally a small fraction of the JP5 that they were exposed to, but they are, serious chemicals to pay attention to nonetheless. I think I will move on, but just to give you the flavor, this is thousands of chemicals that we're talking about here. So some people have mentioned to us, oh, you're lucky that you have exposure data. You have the measurements in the water that the Navy did with the Safe Water Drinking Program, the long-term monitoring program. And this is just a snapshot of their dashboard. It's actually pretty amazing data. They did put a lot of data together over, let's see, this is actually kind of an old slide, but more than 8,000 samples were measured, and now they're in the extended drinking water monitoring program. So even more samples are still being tested. And it's not just JP5 or total hydrocarbons that they're looking for. They're looking for a whole host of chemicals in these waters. But in terms of our exposure assessment, there really weren't these environmental samples measured that are concurrent with exposure, and certainly no biological samples of the population were drawn that are concurrent. Well, actually none exist at all, really. So when we are piecing together our exposure, we need to consider all sorts of human behaviors, the setting in which people were exposed, just numerous other considerations. I did want to show you this beautiful heat map supplied by Department of Health folks. Thank you very much. Actually, many of our slides are supplied by them. This is representing some of the poison control and emergency department calls that actually was really poison control that notified the state that is of a sentinel event. Effectively, what is it, Diana? When 30 calls come in, a sentinel event is triggered, which alerts everybody that something is going on here. And when they started to look at what was going on, they noticed pretty quickly that it was all going around the Joint Base Pearl Harbor Hickam, which is both good and bad. At least they could concentrate in one area. And these are some of the specific symptoms that were reported both to the Poison Control Center and the emergency department visits. And we can see that for the Poison Control Center calls, there were mostly headache, diarrhea, abdominal pain. For the emergency department visits, there were complaints that were like coughing, choking, throat irritation, vomiting. Oh, I also wanted to note, sorry, in that last slide, that, remember the timeline. COVID was also going on. There was a surge in the Delta variant of COVID. And so when you're thinking about things like coughing and choking and maybe even vomiting and these GI complaints, that it's very confounding. So after this collection of symptoms, CDC and ATSDR became involved, and they performed the first assessment of chemical exposure study in January, February of 2022. This was a sample size of about 2,289 people who completed online surveys and also interviews. Now, that is a big number. It's a very good number. It does not come close to 93,000 people. And then there have been a few others. So that first A study is published, and it's really a wealth of information for us, very helpful for us. There have been subsequent A studies. The second A study was also a survey, a follow-up survey of 986 people done in September 2022. And then there was a third A study that was actually a medical record review, and that included 653 medical records. And then Tara and Ruben, I don't know where you went, sorry, were also involved in a UHERO study of the same population that was drawn from the first ACE study. The only thing is that the first ACE study is published. The lower three ones are not published, but we've been able to have some information provided to us here, there. So it's not entirely public, but I'll try to give high level. And what we see generally in all of these studies is that the symptoms reported seem to affect almost every biological system, nervous system, gastrointestinal system, the skin, the throat. The mental health was an absolutely huge piece. the eyes and the respiratory system. It didn't advance. There we go. And at first, when this was all kind of happening, it wasn't entirely, and it actually is still not known, what the long-term health effects of this exposure are. This is an unprecedented exposure event. So although there are studies of inhalation of jet fuel and there's occupational exposures, primarily of men, largely the military population is exposed to jet fuel pretty heavily, as we understand. But this was an exposure to more of a general population. We have children, we have pregnant women, we have elderly, and so really nobody knows what the long-term health effects will be on those sorts of populations. But in the beginning, it was not so expected that there would be long-term health effects from this sort of acute ingestion event. What we saw is that with all these other studies is that people are still experiencing health effects 2+ years later. So the other thing that we've noticed is that some of those symptoms that I showed you seem to also be similar to symptoms that people would experience with like long COVID or like chronic fatigue syndrome or some of these other, I guess maybe even Gulf War syndrome, right? Some of these other sorts of exposure or long-term health effects. So I also wanted to point out that there were some early actions that were done to support the Red Hill community. The Red Hill Clinic was established through the Navy. There are things we can discuss about that. And also, Department of Defense established a roster of exposed people. They have the doers registry, so they are aware largely of who was exposed on base. But those are the DoD affiliated individuals, not necessarily the community individuals who were exposed. And there have also been additional epi-data center studies that have been commissioned to try to determine some of these health effects. And of course, right away, DHA Public Health tried to put together some training programs for healthcare providers to alert them of this exposure and possible health effects. But the other thing that came out of this was the Red Hill Registry. So there were many people, including Congress and the Centers for Disease Control and Prevention, ATSDR, the State Department of Health and Defense Health Agency, who all recognized that something needs to be done. These people need to be tracked. And so it took a little while, but on just this past summer, University of Hawaii system was awarded, well, it's actually a cooperative agreement to establish the Red Hill Registry. So this is a 5-year cooperative agreement. And we're often asked, and this is a really important thing for us, who is paying for this registry? So we want to be completely clear with everybody, completely transparent. We are effectively funded by DoD. And there are some issues with that, and which is the reason that we have to be clear, but there are layers between DoD and us. So the way that the funding works is that the Department of Defense has an agreement with the Uniformed Services University of the Health Sciences, that is the home of the National Center for Disaster Medicine and Public Health. And then the funding functionally comes to us through their partner, which is the Henry M. Jackson Foundation. So this award was executed in June of 2024. The total funding is $27 million across the 5 years. $4 million of this was for our planning year, this first year. And I just want to point out that the large bulk of the funding is to support personnel hiring and community incentives. I also want to point out our NCD-MPH ecosystem it's actually I wanted to introduce, if you haven't heard of it in this context, is that their mission is to be able to quickly mobilize public health workforce in the event of a disaster. So they have these already established partnerships across the United States where they have basically like zero fund accounts so that they can quickly move money. And University of Hawaii is an ecosystem partner now. So this is the simplified version of the goals of the Red Hill Registry. What we are trying to do, just like most of you all are trying to do, is to connect the community to needed services through a referral program. And we haven't actually identified what these specific services may be. We'll talk about that in a minute. But it could include healthcare referrals or social services or housing referrals. We will also provide educational programs, both for healthcare providers and also for community members. And of course, as part of the registry, we will track their health status over time and gather information on how the fuel exposures may impact their health. I also want to make sure I thank Nicole of the Flint Registry, because everything that we do is modeled on the Flint Registry, and you have been an incredible help to us along the way. So we are in the unique position of being the only registry in the room with 0 participants enrolled. So it is what it is, you know. We do feel very proud of what we have accomplished so far, and that includes building our infrastructure, so hiring our staff and building the website, the social media, setting up our IT, figuring out what is needed for our IT programs. It also includes a congressional report that we were tasked with. It's a mandatory congressional report. It was part of the fiscal year 2024 National Defense Authorization Act, and it was one of the task items as part of our funding to determine the feasibility and necessity of performing an epidemiological health outcome study on this Red Hill exposed population. And of course, the bulk of our work that we've been doing so far is community engagement, because our mission is to co-create the registry with the community along the lines of Flint. So here is our team. We have partnerships. Our team is built, you know, we're from the Office of Strategic Health Initiatives. We work with folks from the John A. Burns School of Medicine, and they provide clinical perspective. The Water Resources Research Center, and they're an important group because they had very close connections with the community right out the gates, because the community called to them to help them with some water screening early on. We also work with, our science team is based in the Thompson School of Social Work and Public Health, and we work with University Health Partners of Hawaii, they provide our IT infrastructure, and they'll also be the home of most of our participant engagement staff. A few details about our feasibility assessment report. It was daunting. We basically had to learn really quickly about a lot of the literature around the jet fuel exposure, possible health effects. We had to quickly think about possible recruitment strategies and methods for assessing health outcomes, data analysis, of course, and identifying exposures and eligibility, because as we mentioned, the exposure piece is tricky. It is not just about the November 2021 potentially, but we also want to hear from the community about what they think, who they think should be included in the registry. And of course, we had to think about really quickly how we would provide information on resources and services, especially now that our population is both civilian and military. And I didn't know before this project that Hawaii is considered an overseas duty station where they tend to move every 3 years with their jobs. And so now that we're at the 3-year mark, we're looking at potentially a global effort to try to find these people. And of course, we're building the registry to be a repository for data for future research, because everybody wants to know the long-term health effects of this exposure. I will turn it back to Tara.
So with all this community engagement, I'm not at my desk very often. You'll often see me out in the community doing whatever I can, going where any of who I call my neighbors will be. I've participated in town halls, community meetings, just giving quick announcements at neighborhood boards. In the right side of the screen, there's an organization called Shut Down Red Hill Mutual Aid, and they disperse free water at the Capilina Beach homes, some of the civilian homes affected. And so I've gone out there and helped with that, and also talked about the registry to those impacted individuals, and participated with fundraiser that they had. Just anything I can do. If I think my neighbors will be there, I'll probably show up. A big part of what I did in the very beginning was just try to figure out who is in the Red Hill conversation. You know, there's people everywhere. Of course, I knew about the University of Hawaii and other educational areas because people are doing research on this. But then, you know, I just tried to create a map and figure out who's connected where and how is everybody plugged in, and just spread from there. Because as Flint knows, having those community partnerships in order to help get that word out is really critical. I'm also preparing to establish a community advisory board, and this will provide oversight throughout the beginning of next year through the development of the Red Hill Registry. And so being able to understand who is in the community and who various stakeholders are will help me to build that. Last week, I finished round 1 of some very powerful focus groups. They were pretty amazing. The conversation included like who we reached out to. We had 3 specific categories of community, if you will. The impacted community members, concerned residents of Oahu who may not have been directly exposed, and then professionals who responded to the crisis or provided support to those affected. So we were really trying to just kind of create a focus group where we can get a variety of perspectives. I did drink the jet fuel, so I have a certain perspective, but we need so much more than that, and we need people who have been caring for the community as well as, you know, people who were impacted differently across the waterline. So these focus groups, we had about 25 participants, and they were also given an online survey to help quantify some of the main points that were discussed. And there were a lot more people who didn't have availability in line with what we were offering for focus groups. So what we decided to do is make the survey more community oriented and go more broadly dispersed. So you're all service providers with good ideas about health registries. I know I can't have one-on-one conversations with everybody. If anybody has thoughts and advice on things that could be impactful and useful for our work, please scan the QR code and join us. But at the end of the focus groups, what I did is I asked, what was the one thing that really stood out to you today as the most important topic that we covered? And these are some of the things that people said. Overwhelmingly, no matter who said it, everybody was glad that this was just happening. And then transparency was not far from that. Be transparent. Do what you say you're going to do. Don't leave anybody out, and don't overpromise. If you can't do something we can handle being told, that's not in our reach. A big thing was learning about trauma-informed approaches and trauma-informed care. The community really was impressed that upon us that that's some things that they want, and they were also very pleased that impacted people were being hired to work on the registry. So how are we going to get everybody? We have 93,000 people from Germany, Georgia, Guam, right? The 3 Gs. So it's a pretty major task. Our small team does now have a communications guy, so we're leaning on him as well with his creative ideas. But to get us really started, Sonny mentioned the doers registry, and this is what the DHA had put together at the time of exposure, where they just said, well, here's the military people, and put them into a list. And that list is quite significant. It's about 45,000, but it is only half, right? Because there was a lot of DoD employees or retirees, and then there's people who have zero connection to the military whatsoever. So it's a lot. Our pre-enrollment survey, that's the other thing we're doing. This is launching in December. It's December now. Oh, my Lanta. Whew, there's a reason we sweat on this team. So we're launching our pre-enrollment survey, and what this is going to try and capture is our basic exposure, where were you at your exposure, contact information. But ultimately, the baseline survey for the survey itself, for the registry itself, will launch mid next year, and that obviously will go much more in depth. We have a lot of education planned. I'm going to go a little bit quicker. These are some of the things that we're focusing on, but the topics are some of the really key things that came out of the focus groups. Cultural education, true history of Hawaii and the militarization and environmental health, legal protections for impacted individuals as well as providers, because there have been people turned away from the medical community because providers are afraid of lawsuits. And then pet health is a huge thing. People are very concerned about their pets. I'm going to turn it over to you.
Okay.
Wait, well, let me just talk about the challenges, because this is something, and we're going to go fast because we got the red card. All right, so some of the challenges that's really key for our community is the fact that it's military and civilian. And we've talked about the disbursement. That's an obvious one, but there's also this very fluid kind of concept for access to healthcare. For example, my kids, when they drank the jet fuel, were 16 and 17, but now they're 21 and 22. Well, that doesn't add up, but you don't make me math, but you get it, right? Now they don't have access to the healthcare that they did have, and they were kicked out of that system. So now they have to, hopefully have jobs that provide healthcare and start over with new providers. Now, this also translates into how you're related to the military, or if that status changes. If you separate from the military, dishonorable discharge, if your active duty spouse passes away, there's all these things that really play into that, and I hope that our registry can capture access to healthcare and how that affects your outcomes. Institutional betrayal and trust is a really big deal with this community. It's not just, I say just, but it's not just that an institution betrayed. It's the one who is charged with protecting everybody hurt me. And then that is also my employer, the one who gives my house, who gives me health insurance, the grocery store I shop at, the doctor is in the uniform. Like, you see how it's like every single area of our life. So speaking up about what happened is very scary, and participating in a registry can be very scary because you want to know you're protected.
We already talked about the eligibility issues anyway. So I also want to briefly mention that some of us on our team have been talking about workforce development in the environmental health space in particular. And so a sustainable registry requires a suitably trained workforce. We recognize that as an issue, but also as we're in this room together talking about, environmental health across the Hawaii, there are shortages of workers everywhere. So we have been, we also have been, in terms of our education, working with healthcare providers to try to train them on this exposure, and also on some of the Maui wildfire exposures, hosting workshops and other ongoing activities, including working with the Hawaii Public Health Workforce Catalyst Lab, which is housed in the Office of Public Health Studies, to provide more training opportunities. And then I just want to quickly point you to our website where actually that's an old slide, so now we have some news posted too, where you can subscribe for updates, and shamelessly put in a plug for anybody who may be looking for a job, that we have an employment tab up. There's only one job listed right now, but soon we'll be looking for our participant engagement staff, and we, like we said, want to recruit from the community. So thank you to you all for coming together. Thank you, Alika and Ruben, for putting this together. We are trying our best to be sponges and soak it all in, and so helpful for us. And we want to acknowledge all of you for providing your wisdom, your expertise, and especially we want to acknowledge the Red Hill community and the people of Hawaii who recognized the problem and spoke up, and they fought for their answers. So